Brucellosis. Brucellosis is found globally and is a reportable disease in most countries. Human brucellosis is also known as Malta fever, undulant fever, Mediterranean fever, rock fever of Gibraltar, gastric fever, contagious abortion. Animal brucellosis is also known as Banks disease, enzootic abortion, epizootic abortion, slinking of calves, ram epididymitis, spontaneous abortion. The disease now known as brucellosis was first discovered in the 1850s in Malta. Sir David Bruce considered the agent spherical and classified it as a coccus. Bruce's assistant, Surgeon Captain Matthew Lewis Hughes, named the disease undulant fever and the bacterium Micrococcus melitensis. The genus Micrococcus was changed to Brucella in honor of Bruce. Accordingly, the disease has been renamed as brucellosis. In 1897, Danish veterinarian Bernhard Bank isolated the rod-shaped organism from the abortion cases and classified it as a bacillus. In the late 1910s, American bacteriologist Alice C. Evans was studying the Banks bacillus and gradually realized that it was indistinguishable from the Brucecoccus and hence considered them as Coccobacillus. Classification. It consists of domain bacteria, phylum Pseudomonadota, class Alpha Proteobacteria, order Hyphomicrobials, family Brucellaceae, in genus Brucella. Brucella organisms are small, that is 0.5 to 0.7 micrometer by 0.6 to 1.5 micrometer, non-capsulated, non-motile, non-spore forming, aerobic in nature. Some strains may need 5 to 10% CO2 for primary isolation, hence are also known as capnophilic. They are gram-negative coccobacilli and facultatively intracellular. Brucella species are obligate parasites, and each species has a preferred natural host which serves as a reservoir of infection. Various Brucella species and their primary animal host include Brucella abortus that infect cattle, Brucella melitensis that infect mainly goat, sheep and camel, Brucella suis that infects mainly pigs, Brucella canis infecting dogs, Brucella ovis that infects sheep and goat, Brucella neotome that infects wood rats, Brucella pinnipedae that infects pinnipeds, Brucella setae that infects cetaceans, Brucella microti that infects common vole. Various Brucella species and their biovars has been described in the table. Brucella abortus consists of 7 biovars, that is 1 to 6 and 9. Brucella melitensis consists of 1, 2 and 3 biovar. Brucella ovis, Brucella canis and Brucella neotome consist of single biovar, and Brucella suis consists of 1 to 5 biovar. Brucella species are catalase positive, oxidase positive except Brucella ovis and Brucella neotome, non-fermentative, urease positive except Brucella ovis, reduced nitrate except Brucella ovis and Brucella canis, and H2S production is variable. Susceptibility to the dyes, threonine and basic fission at a concentration of 20 microgram per ml. which varies between biovars, is one of the routine typing tests of Brucella, also known as dye inhibition test. Major species of Brucella have differences in ability to grow in the medium containing basic fission and threonine, which has been described in this table. The production of monospecific antisera to A and M antigen can be used in the identification of the Brucella species. Presence of A and M antigen in various Brucella species and their phenotypic effect on the colony they form is summarized in the given table. Brucella abortus, Brucella melitensis, and Brucella suis form smooth colonies. They consist antigen A and M. Brucella ovis and Brucella canis can grow as rough colonies that possess R antigen. Cultural characteristics. Brucella species are aerobic. Some species require an incubation with added CO2, 5 to 10% during primary isolation. Enriched medium is needed to enhance the growth. Brucella colonies become visible on suitable solid media in 2 to 3 days. Primary culture of Brucella reveals punctate, non-pigmented and non-hemolytic colonies. The colonies of smooth strains are small, round and convex. Transmission is animal is via direct contact with excretors, in the ingestions of infected tissues or body fluids. Venereal transmission occurs mainly in swine, sheep, goat and dogs, but it is rare in cattle and bison. It is less commonly transmitted via inhalation, conjunctival mucous membranes and in utero. Transmission to human takes place via ingestion of unpasteurized dairy products and undercooked meat, inhalation of infectious aerosols, laboratory workers during handling of pure culture, and slaughterhouse employees, veterinarians and farmers while handling infected animal or their tissues. Via contact, that is absorption of the bacteria, can occur through conjunctiva or broken skin or wound by coming in contact with infected tissue, blood, urine, vaginal discharges, aborted fetuses, placentas, etc. Via skin wounds or mucous membranes and occupational hazards in slaughterhouse workers and veterinarians. Brucellosis is essentially a disease of a sexually mature animals. Erythritol stimulates the growth of most Brucella species. It is present in the placenta and male genital tract of cattle, sheep, goat and pig. Infected animals generally develop granulomatous inflammatory lesions found in lymphoid tissues, reproductive organs, udder and supramammary lymph nodes. Organism mainly cause abortion and sterility. Animals generally abort once, although reinvasion of the uterus occurs in subsequent pregnancies and organisms are shed in the membrane and fluids. Asymptomatic carriers shed Brucella organism in their milk, urine and reproductive tissues. Brucellosis in cattle and bison is caused almost exclusively by Brucella abortus. It causes abortion typically once during third trimester. Subsequent gestations and lactations appear normal. Clinical signs include inflamed and retained placenta. Once it is expelled, have leathery appearance. Animals give birth to stillborn or weak calves. there will be reduced milk yield and infected animal will shed organisms in their milk for life. In males, clinical signs include orchitis, which is more common than epididymitis and cause fertility. Brucellosis in horses is caused by Brucella abortus and Brucella suis, or could be of traumatic in origin. Can cause abortion occasionally. The most common abnormality associated with brucellosis in horses is suppurative bursitis, fistulous withers, paw level. It is a pus-filled inflammation of connective tissue over the shoulders or paw. Transmission from infected horses to other animal or human is less likely. Brucellosis in sheep and goat is primarily caused by Brucella melitensis and Brucella ovis. The predominant symptom of an acute Brucella melitensis infection is reproductive failure with late-term abortion, birth of weak offspring, and retention of placenta. In goats, articular and periarticular hygroma localizations are seen. Brucella ovis cause abortions and fertility problems in sheep. In ram, it causes epididymitis, which is more common than orchitis. Infertility, organisms may be shed in semen. Brucellosis in swine is primarily caused by Brucella suis. After exposure to Brucella suis, pigs develop prolonged bacteremia. Common manifestations are abortion, temporary or permanent sterility, orchitis, lameness, posterior paralysis, etc. Abortions may also occur early in gestation and can go undetected. Sterility in sows, scales and boars is common. In boar, orchitis is usually unilateral and there is reduced fertility. Brucellosis in dog is primarily caused by Brucella canis. The primary sign of the infection in females are abortion in last trimester of pregnancy or stillbirths, prolonged vaginal discharge, bacteremia for up to 18 months post-exposure and infertility. In males, the primary signs of infection are epididymitis, which is more common than orchitis, prostatitis, and infertility. Brucellosis in humans. Humans are susceptible to Brucella abortus, Brucella melitensis, and Brucella suis. Brucella melitensis and Brucella suis often give rise to a severe and long-lasting form of the disease. Asymptomatic infection is frequent and is mainly caused by Brucella abortus. Symptoms differ considerably, making clinical diagnosis difficult. Initial symptoms include fever, sweat, muscular or joint pain, headache, and fatigue. Chronic cases include spondylitis, recurrent fever, arthritis, granulomas, and endocarditis. Brucellosis in humans do not cause abortion. Person-to-person transmission is also rare. Diagnosis of brucellosis include direct macroscopic examination, isolation of organism, serology, Brucellosis skin test. Direct macroscopic examination. Impression smears are made from colonies or specimens, that is cotyledons, aborted fetal stomach content or spleen, uterine discharge, etc. are stained by the Gram stain or by modified Ziehl-Neelsen stain. Organisms appear as small red staining Gram-negative cocobacilli. In smears containing cells, Brucella may appear in clumps in neutrophils or macrophages or infected cell because of their intracellular growth. Isolation and identification of Brucella organism. The gold standard in brucellosis remains the isolation of Brucella species, but the organisms are slow growing and difficult to isolate. Growth is enhanced on enriched media. Brucella ovis and Brucella abortus biotype 2 require media enriched with blood or serum. Samples include cotyledons, aborted fetal stomach content or spleen, uterine discharge, milk, joint fluid, and semen. Sample can be inoculated on feral medium or dextrose agar or blood agar with 5 to 10% CO2 for 3 to 6 days. Brucella abortus, Brucella suis, Brucella melitensis, and Brucella neotome usually form smooth, glistening, raised and translucent colonies with an entire edge on primary isolation at 48 to 72 hours. Brucella ovis and Brucella canis always form rough, dull, yellowish, opaque and friable colonies. Serology. The immune response to brucella is characterized by the initial production of IgM antibodies followed by the production of IgG antibodies. Major antigens that are useful for serological diagnosis of brucellosis are the smooth lipopolysaccharide of the outer membrane and internal proteins. No serological test is available to detect antibodies to Brucella canis as it lacks smooth lipopolysaccharide cell wall. These tests are commonly used at dairy farms, slaughter plants, and when marketing cattle. Serology results should be interpreted in the context of the clinically compatible illness and exposure history. Following are the serological tests that can be performed. Number 1 is Rose-Bengal test. Number 2 is complement fixation test. Next is enzyme-linked immunosorbent assay, milk ring test or HER test, and standard tube agglutination test. Rose-Bengal test. It is rapid agglutination test used for the early detection of Brucella-specific agglutinins. These tests have been introduced in many countries as a standard screening test. The reagent is the buffered acid antigen stained with Rose-Bengal with pH of 3.65. The procedure includes allow reagents and serum sample to reach room temperature. Place a drop of undiluted serum onto a center of the slide. Add a drop of the reagent next to the drop of the serum. Mix both drops by the disposable stirring stick and watch out for the agglutination reaction. If no agglutination is seen, the result is interpreted as negative. If even a slight visible agglutination is seen, the result is interpreted as positive. The complement fixation test is widely used for the diagnosis of brucellosis in cattle, sheep, and goat. This test is relatively insensitive to antibody produced in response to vaccination with a live attenuated vaccine for Brucella abortus and melitensis, but highly sensitive and specific in animals that are naturally infected with brucellosis. Because this test is difficult to standardize, it is progressively being replaced by ELISAs. Enzyme-linked immunosorbent assay. ELISA detects antibodies to major important species of Brucella, mainly in cattle, that is Brucella abortus and Brucella melitensis. It is one of the highly sensitive field-approved health screening tests. ELISAs are divided into two categories, the indirect ELISA and the competitive ELISA. The test is being successively used to control brucellosis in some countries like Europe and South America. The test is used to detect the disease in human and animal using blood, serum or milk. Milk ring test. The ring test method is used for the detection of Brucella antibody in milk samples. This technique is specially used to detect brucellosis in dairy herds. It uses the principle of agglutination between antibodies contained in milk and colored bacterial antigen of Brucella to form the antigen-antibody complexes that are progressively carried by the fat towards the surface of the milk and forms a blue-violet ring. The reagent is inactivated bacterial culture of Brucella abortus strain 99 stained with hematoxylin. Ring of cream equal or more colored than the underlying milk is interpreted as positive, and ring of cream less colored than the underlying milk is interpreted as negative. Standard tube agglutination test. Serum tube agglutination test detects antibodies against the smooth lipopolysaccharides of Brucella abortus, Brucella melitensis or Brucella suis. At an optimum concentration of antigen and antibody, large antigen-antibody complexes form and precipitate at the bottom of the test tube. The reaction requires an overnight incubation at 37 degrees Celsius. CDC utilizes a test called the Brucella microagglutination test, which is a modified version of the serum tube agglutination test that can be practiced in volume of 100 microliter without any change in performance. SAT is a standardized and extremely robust test and has proven efficacious in several countries now declared officially free of brucellosis. No longer recommended by an OIE for bovine brucellosis diagnosis, but is still widely used in diagnosis of human brucellosis. Brucellin skin test is a cell-mediated immune assay that detects the specific cellular immune response induced by Brucella organism. The injection of brucellin, that is purified and standardized protein, is followed by a local inflammatory response in the sensitized animal. This delayed type hypersensitivity reaction is measured by the increase in skin thickness at the site of inoculation. This test is highly efficient in discriminating between true brucellosis cases and false positive serological reaction, but cannot discriminate between natural infection and vaccination. The skin test is highly specific, but its weak sensitivity makes it a suitable test for herds and not for individual certification. It is an alternative immunological test recommended by the OIE. In most cases, doxycycline and rifampin are recommended for several weeks. Also, a number of other antibiotics may be prescribed. These include streptomycin, trimethoprim, and ciprofloxacin. Even after treatment, the organisms are not eradicated completely from the host. Brucella in animals cannot be cured. Only the signs disappear and the animals remain source of infection for other animals and humans. For prevention of brucellosis, avoid consumption of raw dairy products and undercooked meat. People who handle infected animal or tissue or during laboratory testing should use personal protective equipment that are rubber gloves, goggles, masks, gowns or aprons. This decreases the risk by educating farmer, veterinarian, abattoir worker and butcher, and notification of laboratory personnel. Eradicate the disease in reservoir species by identifying, segregating and culling of infected animals. Vaccination of cattle, goat and sheep is recommended in enzootic areas with high prevalence rate. Brucella abortus S19 vaccine. It is live attenuated Brucella abortus strain 19 vaccine for cattle for immunizing 6 to 8 months old calves as a single subcutaneous dose. Also known as calf foot vaccine, provides immunity for 4 to 5 years. The disadvantages include persistent serological response, abortion if given to pregnant animals, and human risk. Brucella abortus RB51 vaccine. It is a freeze-dried live Brucella abortus strain RB51 vaccine for immunizing 4 to 12 months calves as a single subcutaneous dose. It is lesser abortifacient than S19, used in USA, Canada, South American countries, parts of Europe and Middle East. Brucella melitensis RAP1 vaccine. It is freeze-dried live Brucella melitensis Rev 1 strain vaccine for immunizing 3 to 6 months old sheep and goat as a single subcutaneous dose. It is considered as best available vaccine for the prophylaxis of brucellosis in sheep and goat, not used in India. The disadvantages include persistent serological response, abortion in pregnant animals, and human risk. Thank you for watching. Don't forget to subscribe and hit the notification bell to remain updated.